And funnily enough, when you remove nurses from a stressful environment to a less stressful environment, they seem to be very nice people.
Oh, yeah, nice. Well, I'm a nurse as well, you know.
They're not very nice, but that's a different conversation. But you know, it just.
There are many people who are moving into the UK for various nursing roles, obviously because the UK needs a lot of nurses. But today I've got a friend and a business colleague who trained as a nurse and was a nurse for a long time, but left after a while. And so today it gives me a lot of pleasure to have my very personal friend Afia here. It's Afia, not Ifia. Here to talk about her career in nursing and what she does now. And I think this is really important because many people who ordinarily would not enjoy or would not want to do bedside nursing do go into it because that is all that they know about. But Afia's journey as a nurse, shows the several opportunities in nursing. And actually, she left bedside nursing and went on to do some very exciting things. So, welcome to Diaspora Careers and Investments. My name is Shadrach, and today I was speaking to my very personal friend Afia about her role, what she does now, her career in nursing, and all of that. In order for you to also, learn a thing or two about what prospects there are in nursing. So, welcome to Diaspora Careers and Investments.
Thank you for having me.
So I mean, you've been following my channel and supporting it, and today, many of my viewers are nurses, mostly bedside nurses. I mean, I trained as a nurse, but did not really like much of the bedside. Went on to do a PhD and then went to do and lecturing now. Tell us about your own journey as a nurse. How long were you a bedside nurse, and then what did you do afterwards? I'll just leave you to flow a bit.
Okay, look, that's fine. Thank you for having me, obviously. So nursing. So I trained in 2010 and I finished my training in 2013. And yeah, like how sometimes people wonder, like, did you always want to be a nurse? I think I did always want to be a nurse. Because growing up, my dad actually wanted me to be a pharmacist or a doctor because he felt like I had the brains to do it. And perhaps I could have done it, but I didn't think it would be something I would enjoy because I wanted to care for people, like hands-on care for people. And I went ahead to do that in 2013 till I think about 2016, 2017.
So that's like a good 4 years.
Yeah.
Okay, so you were a bedside nurse.
Yes, I did that. So I worked, I think my first job was in brain injury. I did that for a while. And then funny enough, whilst I was doing the brain injury, I went to do my masters, or I started to do my masters. And then from brain injury, elderly care as well for a bit. Just a few bits and bobs. I think I realized that there was aspects of nursing that I enjoyed, and there was some aspects that I didn't quite enjoy as I thought I would actually.
Which side of nursing didn't you enjoy so much?
I think it was the politics. It wasn't the patient care. It was the staffing. It was the lack of staff. It was the lack of resources. It was just the drama that comes, and I don't know. It was just not for me personally.
So from there, what did you go to do?
Once I finished my nursing degree, I went to do some volunteer work in Kenya. And when I came back, I realized that there was an aspect of healthcare that I hadn't thought of, and that was public health. So that's what actually led me to go and do the master's in public health. Yeah. Actually, can I just add something quickly? So how I said I always wanted to do nursing? Just before I actually applied to do nursing, I wanted to do midwifery. I can't recall why I wanted to do that. But when I went to the open day for the midwifery course, I was speaking to one of the lecturers and telling them, stuff like that. And they then advised me that in Scotland, which is where I was based at the time, a lot of people don't leave midwifery, they just retire. So in terms of job prospects, I would be better doing nursing as opposed to doing that. And then once I trained as a nurse, if I still felt like I wanted to train as a midwife, then I could do a conversion course,
Absolutely.
which is about 18 months, I think, to do that. But once I finished, then I realized that, I always wanted to be a nurse anyway. So yeah, I ended up staying in nursing till I left.
Yeah. No, that's good. And I guess with hindsight, you see that was good advice, because after that, leaving nursing, you went on to do the assessment care. Can you tell us a bit more about that? Because I found that very exciting.
Yeah. So after I left bedside nursing, I actually got a job as a disability assessor, which is, I kind of worked with a lot of different people. So you work with, there are some medics in it, and some of my colleagues were physiotherapists, occupational therapists. There were some some training rules as well, because although you have to be from a health background, they almost strip you off your identity as a bedside nursing person. They tell you to take your nursing hat off, basically, because they want you to now be a medical advisor to the government, and that's what I was doing. So I was doing medical assessments for the Department of Work and Pensions, to help them to make some decisions that they require health input for, but the decision makers themselves are not health professionals. So they basically use health professionals to give them advice, basically, about how people's health affect them on a day-to-day basis, to then help the case managers then, to make decisions. And that was quite interesting, actually, I must say. It's something that I didn't know about. It's not like I went to look for the job. I had seen the role, and then I thought, maybe I could try, and the money was good at the time.
We'll come into all of that.
So yeah, that's how I got into it, and I did enjoy it. I must say I have learned a lot from that role.
So let us break that down. When you say that for the case managers to make a decision, you were obviously working as a health assessor for the DWP, for the Department of Work and Pension, so that I guess it's for their clients to determine who deserves benefits and...
Yes, so basically my employer was employed by the Department of Work and Pensions.
Okay.
And yes, it is to make decisions about benefits and support, financial support, for people based on their health conditions, basically. Yeah.
Okay. So in terms of what was enjoyable about that job, compared to bedside nursing, I know you had an office rather than going to the ward, and you had a fixed schedule and...
Yeah. So, initially I had talked about the fact that I didn't like the political aspect of nursing. And, there are people who enjoy being on the ward and, talking about people and, like all the things. If you've ever worked in a ward, you will know how this works.
Yeah.
I didn't enjoy it. So when I worked into the assessor role, I was based in an office setting. And funnily enough, when you remove nurses from a stressful environment to a less stressful environment, they seem to be very nice people.
Oh, we are nice. I'm a nurse as well,
They're not very nice, but that's a different conversation. But, just the aspect that I could manage my own caseload. I didn't have to report to it. I did have a manager, and I did have a CSO, which is a clinical specialist lead.
Yeah.
And I didn't report to them. They were just there for support, really. But I like the fact that I come into work, I have a workload.
So it was a lot independent.
It was independent. You had, like I said, I had two managers, but it was more like if I needed support or for them to guide your targets and your numbers and stuff. So I came in, I knew that this is what I had to do. I had my own to-do list, and I just got on with it. And my job was so relaxing. I was going to say chilled. My job was so relaxing.
Beautiful now.
No, it was stressful. Don't get me wrong. There's disadvantages to it. It was very, very, very stressful. A lot of colleagues who would come from the wards, who would come from care homes, who would come from even like GP practice, they wouldn't be able to hack it. Honestly, the staff turnover was crazy. Very, very. It's one of them things that you either were good at it or you were not good at it. It's like Marmite. It was just there was very few people were in between. And a lot of people realized that, when they went to that office environment, that they actually
They didn't like their office
They
environment.
didn't like paperwork.
Was it 9 to 5 also?
Yes, it was 9 to 5. I think I worked In the end, I mean, I started off at 9 to 5, but in the end, I was doing condensed hours so that I could only work 4 days a week.
Wow.
So
okay. So that was pretty flexible also.
Yeah. It was quite good. You know, it was.
Are those roles still like available?
Oh yes, they are very much. In fact, they are very, very popular at the moment.
Wow.
Because I've worked with 2 companies in the same field. One was a face-to-face role, and my most recent role in that field was what is called a back office role. So I actually didn't, in the face-to-face one, you actually assessed people physically in an office environment. But in the latter role that I got, you don't. I don't see any people body. I speak to other health professional consultants and stuff on the phone. Occasionally I might speak to somebody. I can't call them patient, like a client. If I can borrow that word for today. You know, on the phone. And that was.
But you needed to be a registered nurse to. You needed to keep your.
You didn't need to be a registered nurse to be in the role, but you needed to be a medical professional that is registered to a body.
Yeah.
Yes.
No, but you needed an active license in whatever capacity to do that.
Actually, I am still a registered nurse at the moment. I am still under the NMC, and I still do pay my registration.
You do revalidation and all of that.
I still do all that, and I think that was one of the advantages of the job. Although you were not doing bedside nursing, because it was in a health environment, you were still able to use hours. I know a lot of people are concerned about being able to get their hours for revalidation. Yeah. You could still do that, actually.
Let's talk about the pay and the benefits. How different was it from working as a bedside nurse?
Obviously, if you work for the NHS, you know that you have some stability in terms of benefits, the pensions, and you get, your blue light or whatever it is, the discount things and stuff like that. But in terms of this role, the wage was much more, significantly more.
What was the starting role pay for that role?
I think I don't recall 100%, and of course with time, I'm sure it would have risen quite a bit. But I think for the face-to-face role, I think it started around 36.
Well, I mean, for a starting role, that was good.
Yeah, and because at the time I actually lived in, I think it could be a bit more.
Wow.
I lived in Wales, so obviously that would also differ.
Yeah.
And I know that if you live in England, you are looking at something more than that for a starting role, and the back office is obviously a bit less. So I'm sure that starts around perhaps 32, 34.
But I mean, compared to bedside nursing, which starts at, say, 25 or even 23, this is pretty good. Yeah. But you had other perks also. I mean, because I remember you had private insurance and what are you talking about?
No, I mean, apart from the wage, it was great. I mean, I'm not gonna lie at all. Obviously there is some disadvantages, and I'm sure if you really were interested in the role, you could get in contact with Shadrach and I could talk more about it, about the pros and cons. But yes, for my particular company, I was getting private medical care, which the company that I do pay for it, and you could actually add a family member, but which you had to pay yourself. But it was, they took the money out before you got paid. It's like NI and stuff, so you really didn't miss it. There was dental care.
Wow.
There was, if you wanted to buy extra holidays, you could do that. Wow. And I mean, there's the usual office specs, isn't it? The Christmas parties and like a lot of.
Why am I doing this job? I don't get any of this. I don't get any of this. Wow. No, I remember. I mean, because sometimes for the rest of us were waiting on, whether NHS list to get, a scan down or, it's a long list, you have to wait, but you could skip the queue through your, private insurances. And there are people in this United Kingdom who have private insurance. Man, some of us need to change jobs. No, but that was exciting. Did you need to have some experience as a bedside nurse before you come into this role?
Yes. I think at the time, I'm not sure if that's changing at the moment, but at the time you needed to have at least 2 years or 3 years experience. Reason being that the job is quite independent, and there's a lot of knowledge or responsibility that you'll be left with, and it's one of them roles where you feel inadequate if you don't know your stuff. And that's one of the things that I talked about the perks. That's one of the disadvantages. I mean, it worked out as an advantage in the end, but if for instance, I had talked about working in brain injury and dementia care and stuff like that. A lot of the cases that I was getting were mental health or developmental conditions. So, and that wasn't my strongest area. So I had to take time out outside of my 9 to 5 to educate myself on those areas to make sure that I was producing the same as my colleagues who were coming from perhaps a mental health background. But the good thing was, because you worked as a team, and in my team I had like people from a physiotherapy background. I forgot, one of the other colleagues that I also had was paramedics actually. So then sometimes like I remember there was a time that people would be like, oh, I've got a sickle cell case, and who's got experience. I'll be like, oh yeah, I know about sickle cell. Or somebody will be like, oh, I've got somebody that is coming home from hospital, and you want to go and speak to the physio then for that. So it was good, like, to have a collective team to bounce ideas.
Teamwork. It was teamwork.
To bounce ideas from and stuff. So
so what do you do now? Let's talk about now. What do you do now? And then you can tell us a bit more about that too.
Okay, so at the moment I'm working in occupational health, and I'm sure one will wonder, like, if the job was that great, why did you leave? Like I said, there was disadvantages that in the end didn't. I felt like I needed a change. Funny enough, it was actually, I think, the longest job I ever had. It was the longest job I ever had. So I've always wanted to go in occupational health as well, kind of bouncing off public health a bit. And I think the difficulty with that is that I didn't have the occupational health degree. So I think at a later part in my life, when I had that opportunity for the role, I grabbed it because it was a training role actually.
So it's an occupational health training role
that I'm doing,
but
at the moment.
They are paying you a salary also.
Yes.
So they pay you a salary. And how did you find about? I mean, you shared it with me, but just to share with our audience too.
Yes. So whilst I was working in assessments and stuff, as part of the we talked about the private medical health that I got in my job, you would often speak to occupational health practitioners, companies like PAM, AXA. You would get in contact with them quite a lot. For occupational health is so wide. Occupational medicine is called now because it's that. Is that, especially with COVID-19 and everything, the business is just booming. Honestly. And I had, I tried to keep in touch with trying to get jobs around that area. And I guess a colleague of mine went into it, and when I spoke to her, she advised me that actually, since I have done disability assessment for quite some time, and I had kind of had a speck of experience now in assessments and stuff, that would be good, because in occupational health, if I was to work in there's two sides to it. There's quite a few sides to it, but in terms of, you can get like a physical occupational role, which is like screening and things, which is more hands-on. And then there's what I do as well, which is more employment based. And there's quite a lot of assessments writing. And if somebody was to come from a medical award background, it's a little bit more than writing a care plan, for instance. So I think if you had that experience, it would be quite good, an environment. And
in terms of opportunities, like, how good is it? Like, does it pay well? Like,
oh yeah, and I mean, like I said, I have a training role at the moment, and so I'm at the lower band, lower end of the salary band. But even at that, I'm still getting more money than I would have had in assessment, and more money than I definitely would have had in nursing. And of course, we love our nurses. You're doing a great job, but sometimes you just have to just move around a little bit, depending on what you want to do and stuff.
No, I think you make a very crucial point there, that moving around, and I mean, I've certainly moved around a little bit. Moving around is an opportunity for you to whether seek a pay rise and all of that. But it's really encouraging to know that with your background in nursing, it's offered all these opportunities, whether being a disability assessor or being an occupational health person. So anyway, I don't want it to be a long conversation. Would you go back to bedside nursing? All right. I think I have an answer there. What is next for you? I mean,
No, I often say to people that know me well that I would gladly be a care assistant if I
okay.
could get a nursing wage for it. So yes, I would go back to patient care, but perhaps maybe not nursing a bedside nursing role.
Why? I mean, it's not the same thing.
No, because I feel like I enjoy interacting with the patients, hands on. But obviously, with nursing comes a lot of paperwork and things, and you end up spending less time with the patient and actually doing more documentation. So it's either I'm working with the patient or let me get paid to do documentation. So
Well, anyway, you've already shared with us, a few roles that you've moved in from, your nursing background to all of these.
yeah.
What other opportunities are there for, particularly our nurses who have moved from, various places and, it seems all that is available is, bedside nursing. What other opportunities are there which could be even higher paying than bedside nursing or, but they still remain nurses and keep their pin. And I believe if you wanted to do bank shifts on the side,
yes.
you could still do that, So just offered, do you know any other roles, that nurses can apply into which offers, really good wages?
I mean, even in the NHS, you can still. I mean, you don't have to. Obviously, I work private now, but you don't have to even leave the NHS, to be able to get that experience. Because if you look at even practice nurses in GP surgeries, they are not necessarily bedside, and they are 9 to 5. They are on a higher wage band. And they are managing their diaries themselves. You could look at being a well-being practitioner, which will kind of give you a taste of public health and still education. There's still school nurses. That's something that people don't really look at. There is occupational therapy I'm occupational health. There's so many other aspects as well. There's of course physiotherapy. There's quite a bit as well, and of course there's medical assessments. Like I've talked about.
No, that's good. I mean, once you were visiting Glasgow, I thought we should have a conversation about your career paths and the exciting things you've done. And well, you're always welcome to join us on Diaspora Careers and Investments and continue sharing our content. And one of these days, I should actually have, we talk on the business side of things also. I mean, low-key, you're my business partner, sort of, we do a little bit of business together also. No, but thank you very much, and you look all regal and
No, honestly, I had to look for the part from the channel, but no, thank you so much for having me. I think the last thing that I would add is, I guess, research, because sometimes we limit ourselves based on what other people, especially if you've traveled from outside of the UK. I trained in the UK, but if you travel outside of the UK, perhaps you know a couple of nurses already, and you know that when they come, they said you can work in a care home, you can work in a ward. You might want to look for yourself, beyond what people are telling you, what is out there, because people can't tell you what they don't know.
Absolutely.
If your friend or your colleague works in the ward, they can only tell you about the ward. They can't tell you that, you can, I don't know, just be a paramedic or something if you wanted. So I think reading, I guess.
No, that's a really good way to end the conversation. Hopefully that's giving you some thoughts, some ideas that it's not just about working for the NHS, but there are other aspects in terms of, with your background as a nurse, which pays even a lot better than nursing. Well, I hope you've enjoyed this little interview with my very good friend and colleague, Ifia Boache. No, that's not your surname anymore.
No, Boafo.
Boafo, Mrs. Age. Mrs. Ifia Boafo. We'll catch you in the next interview, and hopefully you stay with us. Bye.